I've lived with chronic sinusitis most of my life. I had my first sinus surgery in my 20s, and then I had 7 more. Chronic sinusitis is sort of like having a black cloud following you all the time. You get run down or stressed out, and the cloud starts to get a little darker, and eventually the cloud catches up to you and you get a sinus infection and you start feeling tired. The symptoms I've had with my sinusitis, it always starts out as just low-grade fatigue. There's pressure in your face and just general discomfort and kind of a general run-down feeling, and that doesn't go away. It affects every aspect of your life. I work around the house a lot. I really love to garden in the yard. I've also got an old BMW, so I work on my car a lot. You just don't have energy for that kind of thing. The last surgery I had was by Dr. Chan, a Swedish physician. I had had an infection for probably a month prior with unsuccessful IV antibiotic treatment. One of the things that I really appreciated about Dr. Chan was that he said, well, after we perform this surgery, we need to talk about how to prevent future infection. But I want you to understand that if you start feeling the symptoms of a sinus infection, come into my office and let's try and nip it in the bud. And this was the first time any physician that I've ever seen since I was in my 20s, and I've seen a lot of them, many times for many sinus infections, has ever talked to me about preventing an infection rather than just having surgery to cure one. My experience with Swedish, there are several things that stand out, and one is the coordination of care. So I see a couple of different Swedish physicians, and when I do, they always have my medical record in front of them. They know what medications I'm taking, what procedures I've had. The care seems very coordinated between physicians. There's clearly a lot of communication happening through the record system, and I really appreciate that. My future with sinusitis, I think, looks pretty good. I think Dr. Chan may have corrected kind of a recurring problem in my last surgery, and I think along with his approach toward preventing future infections, I feel optimistic about preventing them in the future.